little better. Can you tone down a little?
Hey guys,
Hi guys.
welcome back to Monday Night Mythbusters. I'm Dr. Carolyn George from Vita Integrative Medicine and Leslie Harrington, Transformational Coach. So tonight we're coming to you from a different spot in my new office just to kind of highlight different areas. And we've got my bookshelf behind us with some good books. And tonight we're going to be speaking about urinary tract infections. So I just want to kind of have you raise hands for anybody that's joining us who has ever had a UTI. It can be an uncomplicated one, a complicated one, just one, many, but who here has had a UTI? And welcome Michelle and Marianne and Ellen. So yes, it's a very common thing. So we like to talk about some of these things that are very common and how you might know that you have one and what to do about it and how you might prevent one. So we've got lots of good information to pass out tonight. Okay, so first off,
Sharing it around.
What is a UTI? So that stands for urinary tract infection. And your urinary tract goes all the way from your kidneys down these tubes called ureters to your bladder, and then to a common tube called your urethra, which comes out of your body, and that's what you pee from. Okay, so I hope you don't mind if I use the kind of common terms, void from, and nobody goes void what?
Urinate?
Urinate, yeah. So we've got all of those kinds of words, but I'm going to just say pee. So I hope it doesn't offend anybody. So there can be an infection at any place throughout that whole urinary tract. It can give different symptoms depending on where it is. The most common place that women will get urinary tract infections is in the bladder. And men tend not to get infections there as commonly, but they still can. And men can get infections in their prostate, which I guess it depends on how you define urinary tract, but can often present as a urinary tract infection symptoms. So we're going to start off talking first about women, and I see we've got some other people joining us, Nick and Kira, and let's see, who else have we got? So anyways, welcome everybody. So the urinary tract symptoms that you might most commonly feel are going to be a feeling that you have to go to the bathroom frequently, that you need to urinate, and then you go, and then you got to go again, and maybe it's just a little dribble, but you keep on feeling this urge like you've got to get to the bathroom. And then when you do go, it hurts like the devil. Okay, it can
at the tail end, right?
It can hurt all the way through. It can hurt a lot to get started, where you kind of feel like a dagger sticking up that urethra, and it can hurt at the end, or it can hurt the beginning, middle, and end. Right.
So does it make a difference as far as where it originates? Because I used to describe it as like an internal pain, like how some people will think because they have an itchy or something different, right? Like how do you distinguish that? So an itchy external irritation would be more of a yeast possibility,
usually, yeah.
Right?
Although sometimes women will feel itchiness and it will be a UTI.
Okay.
And some women don't get as severe a pain, but most women I know will go, OMG, I just never thought I could have a pain like this. And you can't do anything because you just are rushing to the bathroom, and then you go there and a little bit happens, but not a lot. And then sometimes you get some blood happening. So it might be pinkish tinge, or might be frank, obvious blood. And that can freak you out because a little bit of blood in your urine can look like a lot of blood, and you think you're hemorrhaging. And then you don't know if it's from your vagina or from your urethra. And so that entails a lot of trips to the ER because you're trying to figure out what's going on. So burning pain can be it, a dagger-like pain can be it, urinary frequency can be part of the symptoms, and urgency, we call it urinary urgency when you feel like you got to get there. Sometimes you also wake up multiple times through the night. Sometimes you can't sleep because of the problems. Sometimes you'll get low abdominal pain. It's not as common, but you can get it kind of in the bladder area right above your pubic bone, and that can be really distressful too. If it goes higher, if it ascends up from your bladder into your kidneys, then you can have completely different symptoms. Maybe the bladder symptoms go away, and that's happened to a lot of patients that I've had, where they had it for a few days and they thought, oh, they got rid of it. And then all of a sudden, they got back pain and they got a fever and they got really, really muscle achy and pain. And that's when it had gone into their kidneys. And so that can present abruptly with no warning, without any UTI, lower UTI symptoms, or it can be something where there's a prelude of bladder symptoms and then you dive into the kidney infection. And that can be really serious. That's often a reason to go to the hospital, and you often have to be admitted for intravenous antibiotics. Because once it goes there, you are what we call
Much more
septic. Yep. It tends to go into your blood system, and then you get really, really sick. So Kira's asking, does cranberry juice work, and what's the proper time to see a urologist? Good questions. So cranberry juice can work. Actually, they've studied it a little bit, but not a lot. And it appears that something in the juice prevents the bacteria from connecting into the bladder wall, so it can't stay there. And if you flush your system out,
it's like slippery, right?
Yeah, it's like slippery, and so then you can kind of pee it out. So we're going to talk about prevention in a few minutes, but yes, cranberry juice can work, but they don't, as with all supplements, there's good ones and there's lousy ones. And when they study these things, we don't always know what brand they're using, what quality is that brand, and how consistent is it. So you want to really look for high quality supplements. Cranberry juice does seem to be better than the pills, though. However, cranberry juice has a lot of sugar in it. And so we don't like a lot of sugar when we're trying to get rid of an infection. So it can be a little bit of a balance, especially if you're diabetic or you have other issues that make you more prone to bladder infections. And diabetics do have more bladder infections. So pros and cons to that cranberry juice piece.
What about what causes a UTI? How do people get them?
So that's an excellent question. So if you think about where your urinary urethra is, okay, it's right next to your vagina, which is right next to your rectum. And by the way, I should have had a full disclosure on this. I'm going to be talking a lot about genitals, so if you've got small children nearby, you may or may not want them to listen, because I'm going to be clear about the anatomy. Yeah, exactly. So because the urethra is so close to the vagina, and more importantly, so close to your rectum, where you have bacteria, that is an area that's very easy to bring them up to the vagina and to the opening of your urethra, which kind of sits right anterior to the vagina. So if you wipe, and you wipe back to front, so from your bottom forward, or back and forth, you're going to take those bacteria and put them right where they want to be, right in the urethra, and then they kind of climb in there and they find a stronghold and they hang out. So it's almost always from the rectal bacteria. So what else can do that? And it's not only wiping from back to front, so obviously wiping front to back and just one time and then throwing the toilet paper away, and then getting another piece of toilet paper and wiping front to back until whatever you need is all done. Or you can use water, if you have I'm blanking on the name. Very common in Europe and other places where in the toilet.
The little the water spout thing.
Yeah. Anyways, I just
bidet.
A bidet. Yes, thank you.
Bidet.
If you've got a bidet, just washing that area is nice, and kind of then just wiping once in one direction and getting it dry helps to keep those bacteria away. And if you think about other reasons that you might get bacteria in there, if you're having sex, so just the actions of the sex, the in and out of the penis kind of pushes the bacteria from around the rectal area into your vagina, which is right next to your urethra, and then that can bring it in. And so there's something called honeymoon cystitis, and that kind of implies honeymoon, frequent sexual activity. So it doesn't have to be a honeymoon, it can just be a fun weekend. So anytime you're having a lot of sexual activity, you're much more likely to get those bacteria in there. And then especially if you roll over and fall asleep, then they stay in there till the morning. So a lot of women, in order to prevent bladder infections, will get up and go to the bathroom after sex. It can be so much of a problem that sometimes there's something, you can use some antibiotics preventatively after the sexual intercourse to help to prevent it. But I'm going to talk about that all at the end, but I just wanted to kind of fit some of these pieces together. So avoiding things that can keep the area moist, so sitting in a wet bathing suit, holding your urine is another really, really, really common reason, because then those bacteria that are there anyways, they get into the urethra, and if they're not meant to move, if you're not peeing every 3 to 4 hours, if you go all day long and don't pee, that's our teachers, our nurses, our stewardesses, there's a lot of people who do not go to the bathroom frequently because of
and then in turn, they don't drink that much because they don't have time
they don't
to go
want
to the
to,
bathroom,
right?
and then not drinking enough is another common cause.
Correct, yeah. So all of those things will lead to an issue where the bacteria are there and they're not being flooded out, and then they can start to take root, hold on to the bladder wall, and start to grow. And if you throw in there some extra sugar in the urine, say you're diabetic and you've got poor control of your blood sugar, or some of the new diabetic medications make you get rid of your sugar through the urine. It's a on purpose type of thing, but you can end up with a lot of sugar in your urine, and then you're more likely to get bacteria love sugar, right? And so then you're more likely to get a bacterial infection or a yeast infection, even with some of those medicines. So those are kind of some of the main reasons why you might get it. So bacteria they're in proximity, they're not getting flushed out, and you may have some underlying health issues that can exacerbate or potentiate your already potential triggers.
And a weak immune system in general, right? So.
Well, yes, sure. Weak immune systems when you're not sleeping well, when you're not eating healthy, when you're under a lot of stress. Often when you're under a lot of stress, you're eating more sugary foods, you're not sleeping as well. You maybe are working so hard that you're not stopping to go to the bathroom and take care of yourself.
Okay, so when I grew up...
Actually, constipation is another reason too.
My mom was very adamant about not using antibacterial soap.
Mm-hmm.
So that can be because of, I guess, us as a society, everything's antibacterial, right? But you don't want to be using soap down there that's antibacterial.
Well, I'm not a big fan of antibacterial soap anyways, so I would agree with your mom. Just good old soap and water. Good old soap and water is really the best thing. Yeah.
And the other thing they have, you see a lot of, is these Cottonelles. Mm-hmm. The little wipes everyone's using on the toilet, they think that they're being clean, and some of those are also providing that.
So sometimes, and it's not even so much the antibacterial, although that can be an issue, but it's the fragrance that they put in it. It's very irritating to the we call it mucosa, but the area around the vagina and the urethra is particularly sensitive. So sometimes those smells and the perfumes and stuff that they put in those are very irritating and can really hurt the tissue, and then that can make it, if it gets irritated and inflamed, it makes it easier for those bacteria to get in there. The other thing to recall, or to know, not to recall, but to know, is that once women hit around the perimenopausal time, when estrogens are going lower in their levels, estrogen helps keep that tissue around the vagina really healthy and flush, and the blood flowing there. So when you go through menopause and you have less estrogen, the tissue around your vagina and the urethra dry up a little bit, and it's not quite so as kind of blood filled, protected. And so it's easier for it to get little cracks, small little cracks, and those little bacteria can go in there. So it's very, very common for women after menopause to get way more urinary tract infections, and often your gynecologist will suggest using creams, estrogen creams, that you can put as a little vaginal insert, so that you can get the estrogen in there to help to prevent that. So that can be another reason. So there's plenty of good reasons for women to get it. Now, let me just spend 1 second on men, because I don't want to leave men out. Men can get urinary tract infections, but much less common, because if you think about the anatomy, their urethra is much longer, right? Depending on what your 3 or 4 or 5 or 6 inches is, right? Guys always are challenged in sizing themselves. So the urethra anyways is longer. And so it's harder for those little bacteria to get all the way up the urethra into the bladder. Now that's not to say it doesn't happen, it certainly can, but it's much more common that when a guy has those symptoms of burning when he pees, going more frequently, sometimes a discharge, blood in the urine, much more likely for him to have actually an STD, sexually transmitted disease, rather than a rectal bacteria from around the rectum causing it. It's much more common to be an STD like chlamydia or gonorrhea. So guys under 50, 60, urinary symptoms should always be checked for STDs. They can be checked for other kinds of infections, but you'll generally, when you go into the doctor, and that's probably a good thing for me to talk now about when to go to the doctor and what they're going to do. But the guys need more testing than most women do, just to kind of start off there. So you have got this pretend scenario. You have got burning when you pee, you're going more frequently, you've got this pain that you can't handle, and you're going, I must have a urinary tract infection. What can I do? I don't have time to see the doctor. So if you catch it really quickly, the minute you start to have any of those symptoms and you start to go to the bathroom, like you drink a lot of water, so you're peeing a lot, maybe you pick up your cranberry juice, you can pick up something called Azo, A-Z-O, at the drugstore. Azo pain relief, because now there's all kinds of Azo formulations. So Azo pain relief has something in it that is a urinary anesthetic, and that can take the burning away. It does not make the infection necessarily go away, though. It buys you some time, but not a lot. So I tell you that specifically because I don't want you to take that and think, oh, pain is gone, I'm good. Pain might be gone and you can work on flushing it out of your system. But if when that wears off, you still have the pain, then you definitely need to see a doctor. Okay. And so your primary care doctor can handle it. Your gynecologist can handle it. The urgent care can handle it. Most of the time, you don't need to go to the ER for that. If it's the middle of the night and you can't possibly wait till the urgent care opens in the morning, then that might be something you choose to do, but that's a very expensive way of treating something that probably could wait till the morning if you take a dose of Azo. But you do need to see somebody because ideally you have a urine culture done. There is a little bit of controversy in the medical world about whether simple, uncomplicated urinary tract infections need to have a urine culture done. I tend to like them though because I want to give the minimum amount of antibiotic that's necessary, and I want to know what bacteria caused it and know if the antibiotic I gave, because I'll give you one before I get the culture back. The culture is going to take 2 or 3 days, maybe 4. I'm going to start you on something, and then I'm going to wait for that culture to come back to guide me, to tell me, okay, yeah, this is E. coli, it's sensitive to macrobid, you're good. Or it's E. coli, it's not sensitive, I need to switch your antibiotics. Because there is a lot of resistance, as you can imagine, with all antibiotics there are, but with the urinary tract, there's also quite a few antibiotics that are resistant.
Is it possible to have maybe some blood in your urine but not have symptoms? That would be considered a UTI, or is that often not
possible, but
UTI?
less common. You usually have symptoms. If you've got painless blood in your urine, we call that painless hematuria, then you do want to be checked out because that can be other things, such as bladder cancers or kidney stones. Sometimes kidney stones don't always have pain all the time. So yeah, you want to check other things, right? So sometimes that can be more serious. Sometimes it can be good to have pain because it's a simple solution, a simple cause. So if you're coming to see me, you're going to get a physical exam. We're going to do your vital signs, make sure you don't have a fever. I'm going to check your back, make sure that you don't have pain in your back where your kidneys are. I'm going to feel your abdomen to make sure that there's not other causes. Not very frequently, but it's not uncommon that appendicitis can present as a urinary tract infection, and it can give you blood and pus in the urine. It can give you pain in the same area, but you have much more abdominal pain and not as much urethral pain. But if the appendix is sitting close to your bladder, it irritates your bladder and can cause a lot of the same symptoms.
Interesting.
So that's why your doctor may want you to come in rather than just treat you over the phone, because they can't examine you and see if you do have any abdominal pain. And if you have abdominal pain on palpation, that is not normal for a uncomplicated urinary tract infection. So then we worry about other things. So if you don't have any abdominal pain, no back pain, no fever, and you just have those symptoms, then you're most likely going to get a culture, and for sure, most likely to get a antibiotic. Antibiotics can be given for 3-day courses, which is what I usually do. You can do a 5-day course. You can do a 7-day course. You very, very, very rarely need a 10-day course unless it's what we call complicated. And by complicated, I mean you've got a fever, you've got abdominal pain, you're diabetic, you've got multiple drug resistance, you have recurrent UTIs. Any one of these things could mean that you may have some particularly bad organisms, or it may be hard to get rid of.
Mm-hmm.
And so then you may want a longer course of antibiotics, but not 9 times out of 10.
So we talked a lot about prevention as you went through.
Right.
But just to highlight some of them, basically, if you are having frequent sex, you want to make sure that you're going to the bathroom before and after.
Yeah.
So not holding your urine, drinking and flushing as much as you can, quality water, making sure you're staying hydrated. If you're in that menopausal period, you might want to look into something for the vaginal dryness.
Creams. Yeah.
We talked a little bit before this about the senior communities and how I knew some friends whose parents had or moms had frequent, UTIs and recurrent UTIs, and she saw that all the time, and I saw that in a couple of my other friends that had senior parents. So yeah, that would be because of the dryness. What did I miss? Bacteria, wiping front to back.
Front to back, yeah. Using a bidet if you've got access to one. Staying out of wet bathing suits or wet clothes.
Mm-hmm.
Those are kind of all the key things. And then now
sweating. We see people in their yoga clothes all day long.
Yeah, right. Especially with the thong underwear we tend to wear, and which kind of really rubs the area.
Yeah. Okay.
And some people will find if you've got a light day pad on, sometimes that rubs the area and starts to cause irritation. You may find that you get more UTIs using that. It doesn't bother everybody, but if you're getting a lot of UTIs, that might be something to think about.
Yeah, and especially with the summer coming in Florida, it gets really humid here, and walking around in the workout clothes, like just changing more frequently and keeping the area clean. But questions, guys. I know the cranberry question would come up because that's kind of the common thing that.
So, and actually, there's the second part of that one question. When's the proper time to see a urologist? So, generally, you're not going to need to see a urologist for a simple urinary tract infection, okay? You often have to wait weeks to months to get into a urologist. You don't want to wait that long to be treated. However, if you get recurrent infections, then you should see a urologist. And if you're getting recurrent infections, one of the key things your primary care doctor should do, or if you go to an urgent care because it's after hours, ask them to do it. Ask them to do a culture, because your urologist is going to want to see, is it the same bacteria each time? If it's always a certain kind of E. coli or always an Enterobacter, I can't, sometimes these words are just
I don't think anyone knows
yeah.
what that is.
If it's always the same kind of bacteria, then that means you've got to wonder, do you have a kidney stone that's kind of infected and is kind of constantly seeding your bladder? Or are you not getting rid of it? Or do you have an anatomic issue with your bladder? Sometimes you can have problems with those ureters that come from your kidney into your bladder. So if it's always the same organism, that gives them a clue. So if you've got 3 or 4 different cultures and they're always the same, that can tell them something different than if you've got Enterococcus this time, E. coli this time, and Serratia this time. That you don't have to worry about the names, but just knowing that they're different and going to them with 3 or 4 cultures can really help them figure out what they need to do.
Going on.
Yeah, right. So, and when you see a urologist, they'll almost always need to put a catheter in your bladder and look around. Not a catheter, but a scope in your bladder and look around. So they want to look at what's going on with the lining of the bladder, and they'll want to do some tests to look for those anatomic abnormalities like ultrasounds and things called VCUGs, voiding cystourethograms, for those of you who are wondering what VCUG stands for. That just means you're peeing and they're watching the flow of the urine as you pee to see if everything's doing what it needs to do. And emptying properly, yes.
So can I jump on my soapbox real quick back to, something that you mentioned when you talk about bringing your cultures. Keep your records. So your doctor's office, when you go for blood work, hang on to your blood work, keep your records, know your numbers, have access to them, because it's just so much easier when you go to a doctor and you have something to show them. It just makes a huge difference. I keep a little health binder, call me old school, but I have all of my tests. So if anything ever came up, I can say, well, this is kind of my history. And it gives you, especially if you're coming to someone like Dr. George, who is going to be looking at, from top to bottom, side to side, she wants to know everything that's coming up, because somewhere along the line, some of these things might be related to something bigger, or, it just helps with the pieces of the puzzle. So keep your records.
Yeah, keep your records. Yeah, you can always ask for them. Absolutely. And if they give you a hard time, you can have them faxed to your primary care doctor's office and they'll give you a copy. So yeah, that's a really good point. I'm trying to think if there's any key other things. So I guess the key thing is urinary tract infection symptoms almost always end up happening after office hours, right? It's always going to be in the evening, the weekend, when you least want it, when you've got a big event coming up and you don't want to be spending the weekend in the bathroom. So using that azo over the counter can be something that buys you time. But I just want to reinforce that it buys you time. And if you can really flush your system out and then your symptoms are gone when it wears off, then you don't need to see anybody. But that gives you, so you can get to your event, you can get through the night. You don't have to go and spend $1,000 in the ER. You can wait till the urgent care or your primary care doctor's office opens in the morning. Sometimes the doctor, if you call the office, they'll say, okay, send in a culture, especially if you had them before. But if this is something that's new, you should be evaluated. Your doctor, if they're a good doctor, will say, come on in, I need to examine you. And if they're not as attentive, they may just order you an antibiotic and just hope that they're right. But you want to get that urine, at least a dip, and you want to be examined. Okay, so those are some of my key things to remember when you're dealing with urinary tract infections. And just don't hold your urine, go to the bathroom frequently, drink lots of good water, not sugary water, not sodas and juices and things that are filled with sugar. You see, we're giving ourselves a look, right? Because we see this so often. Yes, so don't do that. And if you're diabetic, make sure your sugars are under good control. Please don't smoke. Just stay away from smoking because that gives you all kinds of other bladder issues. Stay away from dyes and things like that. Hairdressers are more prone to having bladder issues because of all the dyes.
Isn't the number one cause of bladder cancer is smoking?
Yes, number one.
And that's like an unusual fun fact, because who would know that or think that? You think lung cancer, smoking, right? You don't really recognize that those toxins are sitting in your bladder.
The toxins go through every part of your body, and your bladder is filtering your blood, and so those toxins are in there, and they sit in your bladder and just kind of
especially when you're holding it.
Yeah, especially when you're holding it. And they damage the DNA. They kill the DNA. They break it up. They damage it and make it into cancer.
Yeah.
So,
any questions, guys?
Okay. Well, if you do have any, then feel free to write them down. We'll try to get to them. And until next week, we'll see you. And of course, as always, please make sure you share this little recording, this Monday Night Mythbusters, with anybody that you think might be interested in learning about urinary tract infections and what you can do. And anything else that you might be interested in, please send us a message through Facebook, through email, however you like to communicate, whatever social media you use, and give us some ideas for our upcoming weeks. Okay?
Yeah, what are you guys most pressing to learn? Because this one came up just from some people, around. Hey, what about this? Came from someone else that was a suggestion. So
right. Yeah, okay.
Sometimes we have these pressing things. Like I was kind of obsessed with the cholesterol thing.
Yeah, right.
Not gonna lie, I pushed that one.
Okay.
But give us some ideas, because we're really doing this because we so enjoy anything. We can talk about anything, but we enjoy interacting, and we really appreciate you guys coming out.
So thank you very much.
Thank you.
We're signing off, and until next week, have a wonderful week.
Wonderful week, guys. Bye.